Welcome back, everyone. Are you having some back problems? Well, don't worry. Dr. Azab here is to join us and give us a little tips.
I'm Dr. Andrew Azab with All Family Chiropractic, and one of the things that we treat as chiropractors is a lesion called the subluxation or subluxation complex. Now, what is that? That's where the joints can get stuck or misaligned. That can irritate the nerves, and when the nerves are irritated or compressed or pinched, that can cause pain, numbness, or tingling along the course of the nerve going down the arm or down the leg, causing sciatic pain. Sometimes that can irritate or compress the nerve going up into the head, the back of the head, causing headaches back there. Also, when the nerves are irritated, they not only go down the arms and the legs, but they go and they control and help coordinate all the different actions of the different organs in the body. The heart, the lungs, the digestive tract are all under direct control of the nervous system. And with a subluxation that can irritate those nerves, the organ may not get the appropriate innervation, and it may not be under the appropriate nervous control. The third component is called myopathology, which means muscle spasm or muscle weakness, and the muscles can go into spasm, and they can cause trigger points. And then it can also, the fourth component is histopathology, which means swelling or inflammation in the muscles, in the nerves, and in the joint. And the swelling causes the immediate pain and discomfort that patients feel. And left uncorrected, eventually the joints can degenerate or become arthritic with prolonged subluxation. With trigger points, I'm going to revisit the trigger point issue. With trigger points are specifically an area within a muscle that can go into spasm and that can cause pain referred from the area of the spasm. For example, in the trapezius muscle here, you can have spasm right here, your trapezius, but this can cause pain referring up into the head and causing people to feel pain in the head or headaches. A very common cause of headaches is trigger points in the trapezius muscle, which we treat. Another common muscle that goes into spasm in the cervical spine or in the neck is the sternocleidomastoid muscle. That muscle is the one that contracts when you turn your head and turns your head. When you turn your head, you can see the muscle pop up on the opposite side of the head turn. And that's called the SCM or sternocleidomastoid muscle. And when you have trigger points in it, you can get pain radiating into the ear. I've had patients think they had an earache or an ear infection, and when we checked their neck, and we actually found decreased mobility in the joints in their neck and muscle spasm and trigger points within the SCM muscle causing their ear pain. We were able to help them with that and get rid of that. Another common area, different areas of trigger points within the SCM can cause referred pain into the sinus area, above the eye and below the eye. Right, the sinus area, and that can cause patients to think they're having a sinus headache. We treat all the different components of the subluxation by getting the joint to move better with adjustments and to realign it. That takes the pressure off of the nerves. The muscle spasm we help by doing massage directly on the muscles to help decrease the spasm. And then we oftentimes use electrotherapy and ice packs or hot packs to decrease the inflammation and the spasm.
Thank you, Dr. Azab. If you want more about him, you can check our website or call them directly. Don't go anywhere, guys. We'll be right back after the break.